Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Clarice Grote. Thank you so much for being here, Clarice.
Thanks for having me. I'm looking forward to it.
Let's start by introducing yourself to the audience.
Yeah, so I'm Clarice Grote. I'm an occupational therapist. I am the founder and CEO of my company, Amplify OT. And so one of the things that I call myself is a Medicare specialist. But basically, I am very passionate about all things policy, billing, advocacy, really helping practitioners recognize their value and what they bring to the healthcare system, and helping them see that they too can create change and make our healthcare system work better for us and for our patients.
Yeah, and I really want to dig into how you developed that interest. But when you first started out as an occupational therapist at the bedside, which setting did you work in and how did you get involved? How did you know that you wanted to be an OT?
Yeah, so I knew I wanted to be an OT in somewhat of a traditional way that I didn't know it existed until I got exposed to it, which I originally went to college to be a music therapist, but didn't want to learn to sing or play the guitar. So I actually have my bachelor's in music performance. I play the flute. But I didn't want to do music therapy because it just wasn't quite what I had hoped it would be. And I was looking for something that had a little bit more of that kind of anatomy, science background, which at the time, music therapy just really didn't have that much research for it. And so my mom had actually received OT because she has Dupuytren's contractures, right, which kind of brings in your fingers into that kind of claw shape. And so she had received occupational therapy after surgery and thought I might like it. So I shadowed the OT that she had, really enjoyed the kind of creativity with it, the amount that you're on your feet and talking to people and moving around, but also the science side of it and how much evidence there was to support it. And it's kind of a win-win, right? You only needed your master's to become an OT. I was looking for something that I could kind of get into a job fairly early versus trying to become like a physician and take 6-7 years to actually make a reasonable paycheck. And also that it's a high quality job, right? That you can get out of grad school, you can make good money. There's always going to be jobs available. So it kind of checked all my boxes for a profession. And so that's when I really started leaning into OT. And I just really like the way that occupational therapy approaches problems. I really like how holistic it is, how we think about all these different scenarios. And so that kind of critical thinking, problem solving part of OT is what really drew me to it. And so when I first graduated, I worked in home health. So I worked in home health in Kansas City, Missouri for about 9 months. Really liked home health. What I didn't like was the driving. Unfortunately, my territory was extremely broad. So I could, some days, especially towards the end of my time in home health, would be driving up to 6 hours a day. So I'd see I'd see 2 or 3 patients, but would be driving upwards of 6+ hours a day because I was going to those. I lived kind of more in the suburban urban area of the Kansas City Metro District and would be driving to very rural locations in both Kansas and Missouri. So it just wasn't what I wanted, right? I didn't get into OT to drive all across the country. So I then ended up looking into jobs more locally and really wanted to try acute care. I liked that acute care, you kind of start and stop versus in home health, you take your work home with you, you have to schedule your patients. But I did like that I could have that immediate impact on that patient's life in home health. Plus I had this one patient that gave me honey bread one time. They had fresh baked it. Oh my gosh. So good.
Sounds good.
Right? That it never made it home. I ate that thing way before I ever got home. Full loaf of bread, no regrets. But then I went into acute care. I actually worked at North Kansas City Hospital, if anyone's familiar with the area, and worked there for about 2.5 years. So if you do the timelines, I graduated in 2018. So I worked through the pandemic. in the hospital, and then ultimately left clinical care to do Amplify OT full time in the fall of 21 when I actually relocated from Missouri to North Carolina. So it was kind of a natural transition in a sense, because I had to leave my clinical job anyways, because I was moving, right? You can't do acute care long distance. And so things just kind of worked out. But I know you asked how I got into policy. So I'll kind of, there's kind of two different journeys, right? There's my clinical journey and there's a bit of my policy journey. And so with policy, I've always been very politically minded. My mom was in the military. My dad is a lawyer. So they set really great examples growing up of the importance of being involved politically. My dad did a lot of advocacy work around payday loan reform in Missouri. They did a lot of advocacy work around type 1 diabetes research because my sister is a type 1 diabetic. So they were very involved in JDRF. So I already kind of had this priming of that by being involved in advocacy, by being involved in the political process, that you can make a difference and it does impact our daily lives. So I already had that kind of foundational understanding of the importance of policy and advocacy. But then as a student, so I went to Columbia University. I was part of the graduating class of 2017, which puts me in grad school around the time of the 2016 presidential election, which for anyone who doesn't remember, that was Trump v. Hillary. And at that point, the Affordable Care Act was a hot topic, specifically regarding repeal of the Affordable Care Act. And as someone who at the time was benefiting from the ACA because I was under the age of 26, but over the age of 18, I was able to remain on my parents' insurance. But also because the ACA had changed things for OT, requiring us to be an essential health benefit, meaning that all insurance publicly traded on the marketplace has to cover OT services. And so what I did not want was to graduate, have the ACA be repealed, have insurance no longer be required to cover OT, and then me be unable to find a job, right?
Right.
I did not want to spend all that money to become an occupational therapist and then be unable to find a job. So I wanted to get involved. Wanted to figure out, like, what can I do to try and stop the repeal of the Affordable Care Act beyond just kind of contacting my legislators. So that's when I started doing some research and found out that the American Occupational Therapy Association accepts both fieldwork and capstone students. Now, I did my master's, so I didn't do a capstone. So I did a level 2 fieldwork, which I think is the same thing, right? For PT, kind of, you guys have your clinicals, but ours are 12 weeks. And so I did an elective third level 2 fieldwork. We're only required to do 2. So I did an elective third level 2 fieldwork with AOTA in their federal affairs department. And that was in the fall of 2017, which was right around the time when all of the legislation was coming up around the Affordable Care Act. We had the Graham-Cassidy bill, we had waivers, we had block grants, all that kind of stuff that was happening. And so I was able to live in Washington, D.C. for 3 months, see what an impact we're able to have. We were lobbying on behalf of the therapy cap repeal that passed in the spring of 2018. So I was able to kind of be part of those discussions and meet with legislators, met with like Nancy Pelosi's healthcare, like senior healthcare policy staffer, which was really cool. Met my senator, which at the time was Senator Claire McCaskill, and talked to her about occupational therapy. So really just got to see hands-on how policy is made and how we make a difference, how our national associations work to protect our profession and how important what they do is. But also, I think even more importantly, seeing that people do actually listen to what you're saying, right? That I know we see a lot of times, especially if you watch any of the news about Congress, it can look very dysfunctional, and at times it definitely is. But there are also parts of it that do work and things do get done on the back end. And so I think that was a really important lesson for me to see that my voice really does make a difference, that when you send a letter to your legislator, that they listen, that someone does read it, and that it does make an impact. And so that was really what kind of took me then on my policy journey of like, this is what I like, right? This is what I want to do. I like reading policy. I'm one of those, crazy people who like reading a Medicare document. So, which I know that most people probably cannot relate to, which is totally fine. But that's when I kind of realized that this is what I love to do. This is what I'm passionate about. I have an ability to read it and translate it into a way that's able to be understood. And so I just kind of kept pursuing experiences after that. So while I was working as a clinician and building my skill set as an OT in the medical side, I was also then building my skill set on the policy or non-clinical side I was the advocacy and policy coordinator for the Home and Community Health SIS for AOTA, which are kind of somewhat similar to the colleges that APTA has. So I did that for 3 years, excuse me. I joined my state association, the Missouri OT Association, where I was part of our advocacy committee and led some of our efforts in reforming our Practice Act to improve job availability for new grad OTs, which was obviously important to me as a new grad OT at the time. I had a hard time finding a job due to a policy in our Practice Act, so we fixed that. And then was also the director of practice for a couple of years for the Missouri OT Association, where I led the effort to implement the licensure compact. So we passed the licensure compact for occupational therapy, similar to what PT already has. In Missouri, we were one of the first 10 states to pass that piece of legislation and led some other advocacy efforts around Medicaid expansion and those sorts of things. And now I'm in North Carolina, so I've kind of continued to pursue those advocacy efforts and skill sets. I'm now the advocacy and policy, or legal and political co-chair, I think is the technical term, for the North Carolina OT Association, where we've taken up initiatives around reimbursement for Medicaid. We've done negotiations with commercial insurers to improve reimbursement rates for occupational therapy here in the state. We talked with the licensure board. So really, I just have kind of taken all these different opportunities to learn. I have mentors who teach me about policy. And try and bring that information then back to clinicians, because I know as a full-time clinician, none of us have time to read every bill that comes in front of Congress or our state legislature. We don't have time to set up meetings during the day to speak with our legislators, right? But I do. I have that time. Our state associations make that kind of time. Our AOTA makes that kind of time. And so I try and bring that information back to them and represent our profession to the best of my ability and just kind of keep rolling with it and learn new things every single day. So I know that was a very long-winded answer to your question, but that's kind of the duplicity of my journey as a clinician and as someone who's into policy.
Well, I love that specificity that you just shared, because it really highlights why this work is so important in some of the bills that you were able to get passed and things that you were able to move forward on behalf of other OTs and other professionals. So if someone is listening to this and they say, oh my gosh, this sounds great, I would love to do work in policy, like what would that look like for them? Because I think your journey may be a little bit different than other people's because of your parents' background and how you were, that was part of how you grew up. So it wasn't anything different for you to go into policy. What would you say for someone who this is new to them, but it intrigues them?
Yeah, the best thing you can do is just kind of start reading, asking questions, looking things up. One of my favorite places to start is that if you hear something at work and people say, oh, this is a new policy, this is a Medicare policy, whatever, ask them for that policy. Say, hey, I would love to learn more, right? We don't have to approach it from, I think you're wrong, prove it, right? It's someone from the show me state of Missouri, that tends to be sometimes the approach that I take of, well, let me see the evidence. But more so approaching it from, you can think they're wrong, that's totally fine, but I want to learn more. Can you show me where it says that, right? That's a lot of how I started learning. Is I would hear things like in home health. I worked for a contract company. And so what that meant is that I served up to 13 different home health agencies in my area. And every single home health agency basically had a different policy for how they wanted things done and a different interpretation of what Medicare did or did not require. So I immediately realized, right? So immediately realized that something was up, right? That not everyone is on the same page when it comes to basically federal law, right? Let's not conflate that. Medicare policy is federal law. So something you probably want to be fairly familiar with, not something I want to wind up on the wrong side of. So I just started asking questions and saying, can you send that to me? Where's the document that says that? I'd love to learn more. And then reading it and trying to understand where people are getting these answers. A really great place also for people to start is just with your state association, right? State associations are 100% volunteer-led, both in APTA, speech therapy, and AOTA. Our state associations are volunteer-led, and often they are people who are just like you who are trying to figure things out and better the profession. And so majority of state associations have some sort of advocacy position or advocacy committee. And that's how I got involved. I just literally emailed my state association and said, hey, I'm interested in advocacy. What can I do? Like, what positions do you have? And so I just joined our advocacy committee and started learning. And I credit that experience with kind of saving my license because of that, issue that I mentioned at the beginning. The Practice Act said that we had to have 1 year of license experience before we could supervise OTAs at the time, which I'm sure, like PT, right? A large part of your job is supervising an OTA. As an OTA, you're supervising a PTA as a PT. And so I didn't know that because, admittedly, I did not read my Practice Act thoroughly like I should have. And I didn't know, and my company didn't know. And so if I had not been at that meeting and heard about that, I wouldn't have been able to ask the question, what are you going to do about this policy to my job? And I potentially would have violated my Practice Act for an entire year before.
Right. And not even known it. And then I also would have been putting the license of the OTAs that I was supervising at risk because they would not have had an eligible supervision from an OT, right? And so being part of the state association, in my opinion, saved my license and saved the license of the OTAs that I worked with. And so that's really, I think, the best way to get started is by volunteering for your state association. It's a low barrier to entry. They always need volunteers. They always need people who will help, asking questions, contacting your legislators. Those are your really kind of easy ways to get quick wins. APTA, AOTA, and ASHA all have take action centers where you can send letters to your legislators. It takes 5 minutes and it's an easy way to have an impact. And then beyond that, it's really just looking for what you're interested in. Maybe it's talking to your company of, hey, I'm kind of interested in doing more with policy and quality. Is there something I can do to support our department? Or it could be looking at the call for volunteers from our national associations. Those go out a few times a year. So it's just kind of looking for those doors and looking for those opportunities and then taking the risk and putting yourself forward. I got my first leadership job with AOTA 2 months after graduating. I met maybe 1 or 2 of the initial criteria that they asked for on that application. But for all I know, I ran unopposed. For most of my leadership positions, I have run completely unopposed, meaning that the only thing that makes me different from anyone else is that I put my name on a form and put myself forward. So you don't have to have these experiences and knowledge, because I definitely didn't when I was, a year out, 2 months out. I have learned a lot in the last 6 years. And so just putting yourself forward and saying, I may not know everything, but I'm going to do my best is really the best place to start. So taking the risk. So when people say, I don't know how so-and-so got this position or got this role or got this political office, it could be because no one else put their name in the hat.
Exactly. You would be shocked how many positions run unopposed. And especially, even in state governments, when you look at the House and the Senate, there are a large number of seats that either run unopposed or do not have a serious candidate opposite them. So a lot of what makes people in these positions of leadership, if you ask any leader, they'll tell you, I did not feel ready to do this, or I still don't feel qualified to do this. Even me running Amplify OT, right? There is absolutely nothing that makes me more qualified than another individual for people to put their trust in, besides that I do my best to get things right. I research, I look things up. I do my best to make sure that what I say is accurate, but there is nothing unique, distinguishing about what I have done to do what I do now. There's no certification. No one has deemed me the best person to do this. It's just that I have tried and I have put myself forward. And that's really the only thing that has separated me from anyone else.
And so for those, and I'm curious about this too, but for those who are interested in this type of work, but they're Medicare policy and rules are reading the encyclopedia, how do you, and to your point of, you worked at different places and they all interpreted the same document differently. Mm-hmm. How does someone go about being able to, read that type of language, understand it, and actually use it practically so that they're interpreting it correctly?
A lot of it is just practice and repetition, because it is written in a way that's confusing, right? It's written in a way for lawyers to understand, and maybe they don't even understand, right? It's written in a way that's confusing. And so a lot of it has been practice and time. I start with something that's kind of relevant to you and they're familiar with, right? So when I was in home health, I started there. I started with home health policy because that's what I was familiar with. And so I knew what was happening in practice. And then I kind of started learning more about the reimbursement policies, but that's where mentorship is really important. Not mentorship just clinically, but mentorship in terms of policy. And so I'm happy to kind of serve as a source for that. I have students or clinicians who email me and say, hey, I found this document. This is what I think it's saying. Is this right? And I can, do my best to answer yes or no for them. Unfortunately, policy is extremely vague, right? It's very gray. So if you want to do policy work, you must be comfortable operating in the maybe, the maybe area, the gray area, because it's not black and white. And we do want it that way. That is intentional. We don't want necessarily everything to be black and white because then it can't remain dynamic. But mentorship is important. So I would email my friends at AOTA, and I know that that's not a link that everyone has. But if you're a member of your national association, you can email the experts at those associations. So if you're an AOTA member, you can email our regulatory team. You can email our state affairs team. You can email our federal affairs team and ask, this is what I'm reading. This is what my company is saying. Am I interpreting this right? And they'll help you. And they helped me. My state association helped me with those sorts of things. And so just trying to read it, making an effort, making a guess at what it might say, and then asking for assistance and confirmation. And the more you read, the more you get familiar with what it's talking about, the more you get familiar with the terminology. Because unfortunately, they can't make it easy. Every policy that applies to OT doesn't always explicitly say occupational therapy. It may say providers. Well, under the Social Security Act, we're labeled as suppliers and not providers. So you have to kind of look for those sorts of things, which I'm pretty sure I got that right. Don't quote me on that, but I didn't look it up right before this podcast. But, those are the sorts of things that you kind of start to learn the more you read. It often tends to cite policies within a policy, and you start to figure out, okay, when it says this, it means the Social Security Act, versus when it says this, it means federal regulation. And you just get that from practice, time, and asking questions. And I don't get everything right all the time. Our regulatory team doesn't get everything right all the time. Sometimes CMS comes back with a different understanding, but a lot of it is just practice and asking questions and not being afraid to get it wrong and get feedback.
So given your lens of health policy and all the work that you've done, what do you think would make healthcare safer for our patients and for our colleagues who are still, frontline taking care of these patients?
Ooh, that's a big question. That's a big question. I think the hard part is our healthcare system is so confusing. Mm-hmm. And even saying system is a bit of a generous definition of healthcare, right? System implies that things fit together and work together. And I think that's a generous attribute to give to our healthcare system because it can be so disjointed. I mean, I think that one thing that makes our healthcare system extremely challenging is commercial insurance. And to, somewhat of a political opinion in terms of sometimes the lack of regulation around commercial insurance and what is or is not required. It's very difficult because commercial insurance does not have to reveal how they make decisions, does not have to publicly show what their coverage policies are or when they cover things, how much they pay for things, how they pay for services. That's what is nice about, Medicare and Medicaid is because those are government programs. They do have to publicly show how they make decisions or what's covered, what's not covered, those sorts of things. And there's a public process that you can go through to get that information and even claims data. With commercial insurance, we don't have that. And so a lot of ways that I think we can improve the way that our system works is by first being aware of what our healthcare system is. What's a PPO versus an HMO? What's a copay versus a coinsurance? And kind of where to find that information, which is things that we honestly need to know ourselves anyways, picking out our own health insurance. Mm-hmm. I think that's always like if health insurance and healthcare is confusing to us as healthcare providers who work within the system, imagine how confusing it is to people who don't work in that system, who don't speak that language. And they're relying on us to help them make informed decisions about the next level of care, about what they should ask for. And so that's where I think we can really help get people access to the services that they are entitled to, is by understanding how the healthcare system works, what is actually included in a coverage policy, and helping people navigate that, understanding the difference between Medicare and Medicare Advantage and what implications those have, so we can make appropriate discharge recommendations or help our patients navigate these issues, knowing who to call. It's a lot of information, but that's where I think we can really start, is just by understanding even the basics of what health insurance is, how it works, and what patients technically should or should not have the right to receive, or the process of achieving those things. That can make the system work with much less friction if we understand those situations. So it's a tough question. There's, I think, a lot of opportunity to reform our healthcare system, which is why I want people to be involved, right? But if you don't know where the policy is coming from, it's really hard to advocate for it to change. There are policies that come from our employer that may or may not be based on law, right? Showing up late. Like if your company says, oh, well, if you show up 5 minutes late, that's considered late, right? That's not based on like a federal law or a state law that says, oh, your employees have to arrive within 5 minutes of the start of their shift. That's not a state law. But what may be a state law is, that you have to get TB tested. But that is also probably part of your employer policy. And so if you can understand where these different policies are coming from, you're then much better able to advocate for those things to change. Because if it's a Medicare policy, which is federal government, it's not going to do me much good to talk to my state legislator about that, because they can't do anything about that. Versus if it's a Medicaid policy or something to do sometimes with commercial insurance, that is something that my state legislature, my state representative, my state senator may actually be able to have an impact on, versus if I talk to my federal legislator about some Medicaid specific policies, there's not really much they can do because they're not in charge of that policy. And so a large part of what I do and how I've kind of figured things out is figuring out where is the right place to apply pressure and to influence policy. And I think that's the hardest part about advocacy, is figuring out who is the right person to talk to and where to apply that pressure. And so that's a large part of kind of getting started and making things safer, is learning what's a state policy, what's a federal policy, what's my company's policy, and where can I then make impact. So it's lots of different places to start, but just asking questions is really kind of the best way to get started on that, and taking in information and looking it up, and asking more questions.
Yeah, and I love that you highlighted about the insurance and what it covers and what it doesn't cover, because I find that a lot of the community gets this policy because it's sold to them by a salesperson or by somebody who wants them to have this particular policy. They don't know what it covers. And then they need it for something and realize that it doesn't cover that thing that they need.
Yeah. Oh,
right?
Oh, yeah. You and I mean, we could talk for hours about some of the qualms that I have sometimes with Medicare Advantage plans and commercial insurance plans. But yes, that's a huge problem.
Yeah. I mean, you think about the coverage of even post-acute care, right? Does your policy cover skilled nursing care? Does your policy cover acute rehab? How many days of acute rehab does it cover? Does it cover this type of medication versus that type of medication? Will it let you get brand name versus generic? I mean, there's so many things that go into a health insurance policy that someone may think, oh, I'm getting a good deal when I'm paying less for this particular policy, or maybe they can only pay that amount, but it doesn't cover what they really need it to cover.
Yeah. One of my favorite, I say this sarcasm, one favorite conversations to have is the difference between what may be covered versus what is approved. And especially as an acute care therapist, I dealt with this a lot, right? Where patients would call up their insurance and say, hey, well, they told me that inpatient rehab is covered under my plan, but you're telling me it's not. Well, this is the problem, right? It is technically covered. It is a covered benefit. The problem is that your insurance company requires prior authorization and for someone to meet specific qualifications that they don't necessarily have to tell us what those qualifications are. And then they get to decide whether or not they are going to approve to pay for that policy. And I mean, this is fairly standard practice, even Medicare, right? You have, let's say, home health. It is Medicare does cover home health services. But you have to be considered homebound, right? You have to have a qualifying service on that order, of which OT currently is not considered a qualifying service. There's legislation to fix that, but currently it's not, right? So you do have to meet these kind of certain criteria in order for your insurance to agree to cover certain policies. The problem is what that criteria is not always consistent. It's not clear. It's not public. And that makes it very difficult and frustrating for both providers and for our patients and clients to deal with that. And one thing, that sometimes I like to start with is even asking ourselves, like, do you know how your insurance even covers OT services? Like, how many visits does your insurance pay for? How many visits does your own health insurance pay for PT? And how do they cover that? Right? We kind of have this understanding or assumption that the patients that we see understand what their insurance covers. But I think that's such a misnomer, because we personally probably don't even know what our own health insurance plan covers in terms of our own profession, let alone expecting someone who's not even in the healthcare system to try and understand that. So that's kind of, I think, another area where we have to kind of get rid of some of these assumptions of knowing, oh, well, people know what their insurance is. Because if I had $1 for every time someone said, oh, well, I have really good insurance, so it's going to cover that, and then it doesn't, right? That kind of gives you the opinion that there's no such thing really as really good insurance. But those are kind of the things that help you figure out where to start, is if we can get that baseline understanding and being able to talk patients through some of this process of, well, yes, it may be a covered benefit. It's listed as a covered benefit, but insurance requires X, Y, and Z in order to approve to pay for it. That's what can make getting access to these services challenging, but here's how you can do, here's what you can do to say, or how you can call your insurance company and try and appeal these things. Getting familiar with that process can help make it easier, but also potentially help build trust in the healthcare system. But trust me, it is frustrating, and it's very difficult when you're in those positions where people feel like you're not advocating for them because their insurance company isn't going to cover something, when really it's to an extent out of your hands.
Yeah. So for the person that's listening to this that says, I hear you, Clarice, but I'm only one person, how can I make a difference? What would you tell them?
That I hear you, that I get it. Being a full-time clinician is challenging. And that's where, in my opinion, one of the best ways to be an advocate is to simply be a member of your state and your national association. And the reason I say that is because membership dollars are what fund the initiatives that are taken on by your state and national association. So I'll give an example. I'll give, 2 examples of now that I've been in 2 different state associations. In Missouri, we really struggled with membership for a while, which meant that we unfortunately were not able to have a lobbyist for an extended period of time, because we simply couldn't pay for one because our membership was so low. And what that ultimately meant is that we didn't have someone representing us full time to the state legislature. So when bills came up, like there was a Medicaid bill that came up to expand coverage for non-pharmacological pain intervention, our volunteers, we did our best. We reached out to our legislators. We reached out to people who were in charge of the bill, and they said, oh, yeah, we'll make sure OT is included. This was just an oversight. We'll add OT in. But then unfortunately, when the bill passed and went to the governor's office, OT wasn't listed, which meant that PT was, but OT wasn't, which meant that OT then lost out on dollars and opportunities to provide interventions that would have been reimbursed for non-pharmacological chronic pain management because we didn't have a lobbyist, right? Versus if we had a lobbyist, potentially they could have been there on a daily basis, talking with those legislators and reminding them, hey, OT is not in here, right? And most of the people who are your state volunteers are people with full-time jobs, with families, right? I was working full-time in acute care while I was the Missouri director of practice. A lot of them work in academia, a lot of them have kids, right? And so we do our best with the time we have, but if we had had more members, we could have had a lobbyist who could have done that work. With AOTA, right, their full-time job is to advocate for us. And if we don't have enough members, then they can't pay people to be lobbyists for our profession. They can't pay for them to go to conferences or go to meetings where these key connections are really important. They can't pay for them, right? The Medicare physician fee schedule, I'm sure anyone read the Medicare physician fee schedule? Probably not. It's over 1,000 pages long. But you know who does is our billing expert at AOTA on the regulatory team. And so without members, though, we couldn't pay her to do that, and then couldn't pay her to write a comment letter advocating on behalf of our profession. And so if you are just swamped, overwhelmed, I get it, I hear you, the best thing that you can do to know that you are doing your part is by being a member, because it's not only just it's not what they can do for me necessarily, but by being a member, I know that I'm investing in my ability to be an occupational therapist for the long run because someone is representing me when I'm not able to be there. If you get the time, then fantastic. You can be on your state association. You can write a letter, right? Writing a letter to your legislator can take up to like 10 minutes. And that's also still very effective because they care a lot more what their constituents have to say sometimes than what the association can say. And so we're able to use what constituents say to support what we're doing on the state and national level. And so do what you can. But that's the whole point, right, of a community, right? We are part of a profession. OT is a profession, PT is a profession, speech is a profession. And part of being part of a profession is that sense of community. So when someone else doesn't have the time, but I do, I'm able to step up and support them. Versus when I don't have the time, when I was in the depths of my burnout, there were other people who stepped up to fill my shoes and support me. I had to take time off from being part of a state association to kind of recover mentally, physically, those sorts of things. And while I was not being in a volunteer position, someone else was doing that for me. So that's part of being a profession, is being part of a community so we can lean on each other. So even if you are maxed out, being part of your associations makes a huge difference, even though it may not feel like it.
So if people want to learn more, I know that you have your business, Amplify OT. I would love for you to share about that and what people can expect from that.
Yeah, so Amplify OT, very quickly, I started it in the fall of 2020. Basically, a little bit, I never thought I'd be an entrepreneur. I started it primarily as, right? I started it primarily as a place where I could write under my own name. I'd written a lot for AOTA, OT practice. I couldn't really share those articles without mildly violating copyright laws. So I wanted a place where I could write under my own name to hopefully then be able to get a job in policy. But then it ended up turning into a company and what I do full time. But so Amplify OT, I provide educational resources on Medicare policy, billing, and advocacy. So I primarily focus in the adult rehab space. I dabble a little bit in Medicaid every now and then, but just kind of like with commercial insurance, Medicaid is different in every single state. Which makes it very hard for one individual like myself to keep up with. So I focus primarily on the federal side of those issues. But really, my goal is to empower clinicians and students to engage in advocacy in their daily lives. And that can be as simple as educating a physician or your patient on what OT is, talking to your family about what OT is, or it could be some of the grander gestures that we think about of advocacy, which is attending a Hill Day or scheduling a meeting or being in a leadership position, right? There's lots of different ways that we're engaging in advocacy every day, and we just don't realize it. And so with Amplify OT, I try and take the hard stuff and make it easy. So I talk about what the policy is and then try and translate that into what it means for your daily practice. So I know you talk a lot about quality, like these are the quality measures that are influencing home health and SNF, even though they don't say occupational therapy. This is how OT can influence these quality measures. And therefore, this is how you can use these quality measures to advocate for the importance of your role in your setting. And so I have the Amplify OT podcast that I publish twice a month, where we talk about different policies and advocacy updates. My most recent ones, I know this is currently when we're recording it in April, my most recent article or episodes are on like managed care organizations and Medicare Advantage. And then I have like skilled nursing facilities versus nursing homes and what's the difference coming out. I have a blogs where I always link back to the CMS source and AOTA resources so that you can learn more and read it for yourself. Going to the source is always the best way to find the information. I have multiple different free resources, like I have an OT billing guide, I have a reimbursement playlist, and we'll get you the links for the show notes. And then I have my membership program, which is where I have my Mastering OT Policy course, where I talk about what policy is, health insurance. I go through all those different terms of copay, coinsurance, PPOs versus HMOs, what's a capitated payment model versus a value-based care payment model, what PDGM is, PDPM is, and they're in digestible bits, right? So it's not your classic listening to someone lecture to a room that you're not in for 10 hours. It's like 15-minute videos that you can listen to like a podcast. That's not only used by, practitioners, but is also actually used by up to, I think now 12 universities, OT and OTA programs to teach their students about policy and advocacy. So really trying to take a new approach to advocacy and policy that makes it easy to understand for the daily clinician who may have never looked at this information before. So I'm not targeting managers. I'm not targeting VPs. I am trying to speak directly to the daily clinician who is just trying to get by and do the best that they can for themselves and for their patients.
I love that. I didn't even realize you had a podcast. I'm definitely going to link to that. But for your membership, is it on demand? Is it live? Do you have webinars?
Yeah, so it's predominantly all on demand. So it's kind of set up like a social media, right? We have an activity feed, we have group pages. I have both free and paid memberships. The free membership gets you access to a couple of free webinars, some ones on Medicare, ones on advocacy. The full access membership or the paid membership is what gets you access to the Mastering OT Policy course, which is fully on demand. It's fully pre-recorded. And it does offer CE certificates, so people can take those. It's 6 hours total of content, but it's broken up into 5 different modules, so you can take it in digestible bits, or just watch lessons that are only interesting to you. I do have office hours that are live where people can submit questions, and I will record them and post them in the group. You can post questions to our community forum where both students and clinicians are able to respond. There are over 500 people in the community, so people do respond and engage. You can network that way. And then to try and bring in some more live components, because the membership is fairly new, it's only a little over a year old, is I'm actually hosting a summit this summer. So the end of July, I believe the dates are July 25th to the 27th, I'll be hosting the Amplified Therapy Summit, which is focused again on getting practitioners, students, and leaders all in the same room together to discuss policy and how we can use to influence our healthcare system, but also to help make us better clinicians. And so that will have both a free registration as well as a VIP pass. So that'll be largely asynchronous, so pre-recorded sessions, because I know that all of our schedules are very different. So I didn't want to force anyone to have to take PTO to get this information. So, because I know that PTO is precious.
Oh my gosh, it's gold.
Right, exactly. So, and you always feel a little bitter when you have to take PTO to take a CEU. And so most of it will be asynchronous, but our VIP pass will include access to live sessions that'll happen in the evening and probably on Saturday. Currently, when we're speaking, I'm still working out on my schedule, but we'll have some like live panels and some live sessions. One's going to be on OT utilization in home health, which has become a big problem. And kind of talking through how we can use policy to support ourselves in that area. And so it's just kind of supposed to be a dynamic community. It's always evolving, and it really is what the community makes it. So if people want more live interaction, we can set up live interaction. If people want to just kind of be able to comment and be in a positive space, because we know social media is not always that positive, then that's kind of the point of the Amplify OT community. So I have an app that's currently available to iOS. I'm working on the Android version. And you can download that for free, the Amplify OT app, and that allows you then to sign up for the free membership, and you can get notifications. I post updates there of how to get involved in advocacy, of what the different policies are that are going on. So that way you're not just hearing about it from your boss, but you're also hearing about it before it may even reach you in the clinic, and also then contains action items. So overall, it's just trying to create a community that is positive and that sees the opportunities for our profession. PTs, speech therapy, you're more than welcome to join. Everyone is welcome in the Amplify OT membership. We do just predominantly, we try and focus on OT because that's what I know best, but everyone is welcome. And we do actually have some PTs and some speech therapists as part of our community.
Well, I absolutely love what you're doing and all of the resources that are available. I think that the summit is going to be fire. So I hope so. I hope people take you up on your offer to come. And I love that it's asynchronous so people can, join in when they can, because we all have busy lives and different things. And like you said, PTO is golden. So we want to make sure that we get the information in a way that works for us. Are there going to be CEs available for the courses that's in the summit?
So for the VIP pass, which is the paid pass, they will receive CEs. So the general admission is completely free, gets you access to most of the sessions, but will not offer the CE certificates. I am currently in discussion with a company to help provide me with the AOTA approved CEs. I can't announce that it's definitely going to be approved. Hopefully by July, I will definitely know. So check my website. When this episode airs, I'll know for sure whether or not there will be AOTA approved CEs or not. I'm in the process of getting them approved currently here in April. But For general admission, there will not be CE certificates. I can issue like a certificate that you attended if you needed proof that you took the day off to attend CEs. But because it's free to attend, it's just the information. But the VIP pass will be available for anyone who registers or even after the event. And for those folks, there will be CE certificates available for, I think the current schedule is for up to 2 weeks after the event, because I have to set a time frame for AOTA approval. I can't just kind of keep it open forever, unfortunately. But after that, then we'll issue just regular CE certificates for VIP members, because most states don't require it to be AOTA approved.
Awesome. So any parting words for the audience?
My parting words are to just take a chance, right? Put yourself forward. This stuff can be intimidating at first, but you are not the only one who feels that way. You know a lot more than you think you know, and that you are capable of making a difference, no matter if it is in the simple activities of every day, of when you call a physician to get those verbal orders and say, hey, I'm an OT, and these are the things that I'm working on with your patient. Or if it's in some of those more grander gestures, if you have the time of being part of a leadership position in your state association or in your national association, or even trying to pursue a position, a job in quality or policy or a non-clinical position, right? Those are increasingly popular, and we need practitioners in those positions, especially therapy practitioners. So know that you are capable of making a difference, whether if it's in making a form at your clinic a little more accessible, or adding OT to a form that sometimes OT isn't there. We see that in home health orders, or if it's those kind of what we think of as bigger, grander gestures in advocacy. They're all equally important. And all of us as an individual and as a community are capable of making a difference. And we really are stronger together. So I think that's the main message, is knowing that you're capable of change.
Oh, that's awesome. Thank you so much for being here, Clarice. I really appreciate your time in sharing not only your journey, but also how people can get involved. I think this is super important. So thank you so much.
Absolutely. Thank you so much for having me, Brandy. I really appreciate it.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.